Good evening, everyone. Time to our Agnon class. Our class is continuously going on. We don't keep a holiday. Maybe it's Sunday or maybe it's Monday. For us, it is a class time. 5 to 6 means in the evening class time, Agnon class time. So far, we completed our another section of aphorisms, that is regarding the dynamicity in respect of health, dynamicity in respect of disease, and dynamicity in respect of cure. This area of dynamicity related to vital force, it opens the new vistas. How? Those who are interested, they may study the concept of dynamism in detail. You can get many clues from the book of Fridge of Capra, Turning Point, Web of Life, and so many other. The dynamic concept is to be learnt very well in relation with the modern physics, in relation with the quantum physics. When you talk quantum physics, it tells us about the concept of holism. When we talk of quantum physics, it teaches us the concept of synchronicity. When you learn the concept of synchronicity in the realm of modern physics, every one of us will be enlightened regarding the holistic approach. Everyone will be enlightened about the concomitant, how does concomitant is understood. We will be able to learn that. Another thing we will be learning, that is regarding the cause and effect. So far in the medicine, in the art of medicine, the concept of cause and effect is still based on the linearity. When I say linearity means when you draw a line between the 2 points and you find a very clear cut relationship between the cause and effect. But then this is going to teach you that how you are unable to connect the cause and effect, 2 points, one point of the cause and another point of the effect. You cannot connect them, but they are still connected. This connectedness is something which is related to the non-linearity. When you talk that in the understanding of the Homic Mathematica, we find certain symptoms which seems as such no connection. Whenever I get fever, I become thirstless. Whenever the sun has a particular position, 3 p.m. or 3 a.m., I will get fever. All these things are not connected linearly. You cannot connect just with one single line from one point of the cause to the other point of effect. 3 a.m. and fever comes. 3 p.m. and fever comes. So such kind of connections, they are they are connections, but then of linear, of non-linear in time. So this understanding of the dynamism, what we discussed so far in the concept of vital force, it opens new avenues, new royal avenues, the royal avenue of the dynamism, and more related to the modern physics. And we all must go into the detail of this. What is the purpose? Why? Why should we go? Until and otherwise, we know this kind of connectedness where two things are seemingly not connected, but still they are connected. Such kind of non-linear connectedness. If we come to know, and that too on the footings of the science, especially the modern physics, the it will give us quite a deep depth of the knowledge in us. It will give lot of conviction, lot of faith in the way of understanding of homeopathic materia medica and the concept of law of similia, including the whole organ. And in that case, when you're prescribing to somebody some medicine, you are you're going to be very, very comfortable that the given medicine is going to work, is working and is going to work. Your confidence to sit on the remedy will be altogether unique and perfect. As in the previous lectures, I broke you the news of one case that is a type of, you can say, a type of blood cancer. Not exactly the blood cancer, but then a type of blood cancer where some 6 of the bone marrow transplant were failed. The day one when I worked and when I am able to come up with one medicine, I did not change the medicine. What I changed and played with the potency and the doses. I'm preparing that case. It will be soon shared with every one of you, to the whole fraternity. So, having those kind of knowledge in relation to the dynamism, we will find ourselves that the homeopathic medicine and the homeopathic practice and this kind of concept of individualization and constitutional remedy and totality of symptoms, we use so many of different topics, but then they may look like a olden language, but the concept is unique and the latest as per the science. We as a homeopathic doctor are not backward. We are not orthodox homeopaths. Those who go with proper case checking and come up with the indicated remedy, only one medicine, and selecting a potency and the dose. It is called nowadays a orthodox homeopathy. Whatever it is called, I don't mind. But one thing I'm sharing with you: the way we are practicing, the way the practice of homeopathy is taught by Master Hahnemann in the Organon is still far, far ahead as per the science also. So the way you are practicing, it is the most specialized job you're doing. It is not that an ordinary job in the medicine you're doing. Only thing what we are not doing, we are not really seeing it, and we are not really putting it to one platter of the respect. Somewhere we lack in our knowledge, we are unable to respect it well. And once anything we are not respecting ourselves, others will never. So, how we will be generating that respect and faith and command? After having such knowledge. So, initially, what I am discussing with you all is only the very baseline threshold knowledge in respect of Ognon, as told, as taught by Master Hanman according to the aphorisms. I am just holding this baseline. I am just keeping this shred, uh, this threshold, and I am not going beyond the threshold. First of all, we must be knowing what is all this given in it, and just giving you the glimpses in relation to the art of homeopathy taught by Master Henman in the Organon has got in depth the most latest science behind. I just give you certain examples and certain points to know the glimpse of the science. But definitely, you and me both have to go into the depth of that science. And the only purpose is that we all be getting very much convinced and generate our much more faith towards the practice of homeopathy, towards the art of homeopathy. So, I wish every one of you will be definitely going into the details of the concept of dynamism in the modern physics. There are many books available if you search. Concept of synchronicity by David Bohm, concept of connectedness, and all these kind of titles you can choose and find out. You will get so many of different literature available. We are to pick and choose and read and find out what is pertaining to our understanding. My telling to you all is not that go into the complete physics of all that and learn the formulas. I cannot say anything much on that. But my point of view is the implication of those learnings of the physics, implications to the universe, implication to the society, implications to the medical art in respect of the modern physics and all these topics I'm telling you: synchronicity, connectedness, holism. On that basis, on the basis of modern physics, all these words were explained. We have to go into those details instead of going into the mathematics of it. And one point of time, those who are good in the mathematics, they can go into that. Might be possible, I'm not sure. The all riddle of potencies and doses and all this may be explained according to the mathematics of the modern physics. I cannot say about it, but then is subject to scrutiny, subject to exploration, going into that and learning. So this is what is all about. We discussed so far related to the concept of vital force, or we can say concept of dynamism. Now the next section comes within the doctrinal part is regarding the knowledge of medicine. You see, the whole Organon is written according to the aphorism 3. It is just going to be very simple for you and me, everyone, to learn exactly which aphorism is talking what. So far, we discussed some 18 aphorisms. I'm sure every one of you, every one of you now is very clear that what is the section for what and what is this one aphorism is for what. Maybe if we are not really going into the Organon again and again, we might forget for a moment. But then as soon as you open, it will just be very refresh in your mind. Yes, this aphorism is this. You are very clear now. 1 to 4 is the concept of ideal cure. 5 to 9, it is something. 5 to 8 aphorism is something to the blueprint of case. 9 to 18 is something related to the concept of dynamism, vital force. And in this section, each aphorism is talking what you are going to be quite sure about it. So, like this, we go to the next section, that is regarding the knowledge of medicine. In aphorism 3, the first point was regarding the knowledge of disease. We discussed that how to understand the knowledge in a patient. Aphorism 5 to 8. And from 9 to 18, we learned that the foremost and the important knowledge regarding the disease is to understand that it is a dynamic disease. The concept of dynamism in respect of life, in respect of health, in respect of disease, and even in respect of cure is very important to understand. This is how you can now make out, you can now understand that why it is called theoretical part, means the doctrinal part. Theory is a very, very important term in the science. Theory does not mean that something you are just without any reason talking. Theory is a technical term. When we were in the chemistry lab, when we are in the physics lab, we are in the biology lab, whatever the experiment we are doing, we write those experiments on our practical notebook. What we write, in that we used to write theory. It is the concept in respect of the practical experimentation we are doing. So it is the concept regarding the practical working of it. The whole of 1 to 70 is regarding the concept of it. We learned the concept of ideal cure. We learned the concept of the case checking. We learned the concept of dynamism in health and disease. This is how we are learning. Now today is the time to learn the concept of knowing the medicine. What is the knowledge of medicine? What is the concept behind the knowledge of medicine? Once you are very clear about the concept, you will be going into the experimentation accordingly. The concept is, how do you know regarding what medicine can do what? This cannot be said, this cannot be told like this, that one day one angel came into my dream or whispered in my ears that take this X herb and it is going to cure every disease. Now, having this fairy tale kind of thing, and if any of one of my nearer or dearer is suffering with some A disease, am I going to use it? I will be always skeptical giving that medicine to my sick nearer and dearer one, because I am not sure about it. And fairy tales are good to see and listen, but then it cannot be the concept, it cannot be the theory. And since we all have gone through the author's introduction to the Agrawal, one very important thing we came to know, apart from many others, that there was no plan, no working, no theory, no concept in respect of knowing about the medicines, which medicine can do what. It is never thought of. never planned of. Somewhere some accidental happening has occurred in respect of one particular medicine that became the rule to follow. And that was the whole thing you see throughout last 2500 years. There is no such given method to know that X medicine, when you come to know, you are going to find out exactly what all it can do. Apart from, if you go into the many of the other medicines, in fact, I tell you, the medicines are generally the same. Whatever maybe you do, Ayurveda, they use this haldi. We have is haldi as a kurukuma, and many others are also using. Like herbs are the same. Their usage, their preparations are different as per the pathy, and this varies. And their concept of knowing the effect of the drug are different. So, if you see other Ayush such branches which use herbs as a medicine, you may find many kind of literature in respect of their medicines which are something like this, that somebody told like this drug is good for this, but very less experimentation. Recently they went into such experimentations, but their basic knowledge coming from the ancient time, as these Ayush branches are quite ancient, except the homeopathy. I think the homeopathy is the youngest branch of medicine among the Ayush branches. And if you see the allopathic medicines, their knowledge is laboratory based, their knowledge is animal experimentation based, and they have done certain kind of clinical trials on the human beings before making it a registered numbered drug. But then, even doing so much of science, using so much of science for each of the allopathic drug, they have to maintain a register of side effects. If you see in homeopathy, altogether a different kind of scenario. We, with very nice kind of experimentation, we know our drug, and we even now see, though all the drugs all the time not being experimented the way it is advised in homeopathy, we are not doing it every 5 year or every 10 year, but even the drug provings of Rhinia, Pulsatilla, Lycopodium, done some 200 years, 250 years back by Master Hahnemann. Some, of course, of the British homeopaths and the American homeopaths, they tried to do the all the all the way new experiments on that provings, and they found almost a similar results. So when we are using these drugs, we get wonderful results. So my point of view is to tell you that what concept Hahnemann has given. These aphorism, three aphorisms, aphorism 19, aphorism 20, and aphorism 21. These are the three aphorisms which are going to give us the concept of the understanding of how to know in respect of one medicine what exactly it can do this and what exactly it cannot do this. we are to be very sure that this particular drug is going to remove this kind of fever and nothing else. This we call as power of medicine. We call this as the curative power of the medicine. So we are to know this curative power of medicine, but then what is the concept? Today, every one of you, of course, you have gone through the organon, you know this, the process of drug proving and everything. But again, I used to tell all this thing to you all the time that please go some 250 years back in the time of animal and think what was the scenario and what was the amazing and the most creative activity done by our master, Dr. Hahnemann. No one thought of that this is the only way to know about the drug. And such a perfect way, once you know the drug in this method, this drug will never deceive you. It will work exactly as per its power. And definitely, what is not power, you will not apply the drug. So how can you get any deceiving, any kind of uh, misutilization of the drug? Once you are not doing any misutilization, it is not going to do any kind of harm to our patients or the human beings. So this is about the concept we are going to learn in these aphorisms. So the first aphorism is the 19th aphorism to know regarding the concept of knowing the power of medicine. What all we should be knowing first. This is this is aphorism 19. Now he connected with the word again with now. Aphorism 7, aphorism 17, and now in aphorism 19, he is using the word now. That you understood your job is to know the totality of symptoms. Now what? Now what you should do? Now, as diseases are nothing more than alterations in the state of health of the healthy individual, which express themselves by morbid signs, and the cure is also only possible by a change to the healthy condition of the state of health of the diseased individual. It is very evident that medicines could never cure diseases if they do not possess the power of altering man's state of health, which depends on sensations and functions. Indeed, that their curative power must be owing solely to this power they possess of altering man's state of health. Means, if we simply say in just few words, the meaning of this aphorism is medicines cure by differently tuning a person's conditions. Medicines cure what it produces. Whenever we come to know exactly that what medicines are going to do the alterations, that particular alterations in a healthy individual is nothing but exactly the power of the medicine. That this medicine has altered the health of the individual in this particular peculiar manner. This is exactly the power of this drug. This power can be utilized in a sick person having exactly this similar kind of alteration of the functions, which is on the basis of law of similia, going to cure, going to remove this totality, going to act dynamically to the vital force and remove the alteration of the vital force, which will immediately reflect in the correction, in the uh, getting tuned back to the health of all the functions and sensations. So, the first understanding is this. This might seem very simple to every one of us, that what is this something new? But then the most important thing here is he says the alteration power of medicines in a healthy individual. The catch is the healthy individual. This is something a very, very important statement to know the power of medicine in a healthy individual. Just imagine in the final year of BHMS, there is a condition of doing internship. What is that condition? That every one of you, the new homeopathic doctor, the new making of homeopathic doctor has to undergo the drug proving. You are to do a drug proving experiment on yourself. I know when the first batch of Bexon College where I was working, I found so many of the students of the first batch. They came to me that, sir, we will not do this experiment on us. Our parents are not allowing us to do this. It may do some kind of harm to us. And it was my job morally to convince the students and their parents that such experiments are going to give you rather more faith instead of be skeptical about homeopathy. It is not going to give you any harm. So think the time of Hahnemann. The people who worked with Hahnemann for the purpose of doing the proving, offering themselves as a healthy subject for that purpose. And some of the provers in Hahnemann, including Hahnemann, they were master provers. And they were having many, many more, even children, even females, those who were offering themselves for the purpose of drug proving. It is just a feeling that we are made guinea pigs, but not really guinea pigs. I think every one of you have gone through the whole process of drug proving for aphorism number 105 to 145, where Hahnemann has taught that how the safety measures were taken for these subjects, that they should not be harmed in any way. And it has got, doing this drug proving has got a very, very deep biological benefit. We will be learning what is that benefit when we will be reaching to 105 onwards aphorisms. Here, you try to realize this point that if you come to know across one particular medicine, which is still not in the use of homeopathy, homeopathic pharmaceutical or homeopathic preparations, the only way for us is, the first thing we have to do it and experiment on the healthy individual. If you know the CCRH, Central Council for Research in Homeopathy, they have added many new medicines which are the medicinal herb in the India region. There are many homeopathic doctors of Kolkata, West Bengal, those who added some of the Indian herbs, Indian drugs as homeopathic medicines. I was listening one day the webinar. They 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 taught us about the Cassia sofera. It is one of the Indian herbs. And there are many, many more Indian herbs. Like we know this neem, Azaritha indica. It is one very well-known Indian herb. You will find so much of references of neem, Azaritha indica, in Ayurveda, in Unani, and such. And you will come across many patients, especially those who are suffering with the skin disease. They used to ask very commonly, can we take bath with the neem water? So, like this, there are many such drugs, grass, or the different herbs of India, and there will be many, many more. Like, for example, this haldi, Korokuma, one of my very senior doctor, I saw him in Mitra Medica post graduation. He did a drug proving of Korokuma longa to obtain this MD in Mitra Medica. And I know his guide was none other than Dr. Jugal Kishore, one of the very, very big name in the homeopathy. And such kind of editions they have done. And doing one drug proving is a very, very difficult job nowadays. Much more difficult even uh, because now it is the ethical issues and so many other issues, legal issues, it becomes very difficult to go into the provings. And knowing a drug starts with its proving on healthy human beings. I would refer every one of you, even in Mathematica Pura and in the lesser writings of Hahnemann. There are certain articles which are telling how to know about Materia Medica. Ordinary sources of Materia Medica is one article. You will come to know that how shabbily the knowledge of the drug is obtained. Then Hahnemann explained each and every method of knowing the drug, every method, each and every method, knowing about the drug, how shabbily it is and how insufficient it is. Like if you try to know a drug just by its chemistry, is this enough? He explained that it is not that enough. Then he told knowing a drug on the animals. Hahnemann explained very nicely that one herb is a food to one category of animals, and the same herb is a poison to another category of animals. So just think, how can you know exactness of the power of one particular herb by testing it on the animals? Then he explained you might know some of the informations regarding one particular medicine, one particular herb by testing on animals. But can you exactly know what kind of thoughts and feelings it can produce? Because animals, they have a biological limitation. You may find some of the expressions of the feelings, but then they are quite deficient because the biologically they are animals. They are not given that very instrument, the body, to to express exactly their feelings and thoughts. Even one drug, when it is tested on the healthy human beings, you find quite a different colors and expressions about the drug, the feelings and the thoughts. So in that article, Hahnemann explained very well that this is quite impossible to know exactly about one drug by these methods. Then he also explained in that article, all right, one medicine which is by some thoughts is known to be used in particular disease. If that particular drug is used, like for example, like right from the ancient time, it is known the mercury is a boon in the syphilitic kind of diseases. And because of this knowledge, because of the power of the medicine, it has been poisoned like anything to many those who were suffering with syphilis or syphilis like diseases. Now, in that condition, one thing is possible that we know about mercury by their misutilization as side effects. Hahnemann explained in that article, even that is not the right way to know the drug. It will be somewhere you will mixed up with the symptoms of one particular disease with the symptoms of one particular medicine. Even that is not sufficient. Moreover, the old school habit was to use a drug in a very big quantity. So, whatever you are going to get, it is more of a symptom in a toxicological nature. Henman has given a due regard to these toxicological symptoms. In Mathematica Pura, you will find all those toxicological symptoms along with the proving symptoms. But then, knowing a drug by proving in a healthy means that with a very small quantity, how exactly it is mistuning the functions, how exactly it is deranging the vital force. You will come to know in sensations, in altered functions, and even in thoughts and emotions. You will come to know a very subtle and refined picture of it, which is very much necessary. Hence, accordingly, you will be getting the symptoms of the natural disease where you are going to apply this known drug. So, the most important point to understand today is that it is the most important job for every one of us to understand exactly the proving of a drug, knowing about a drug, what is the power of it is only and only possible when you try this in a particular way, in a proper methodology on a healthy human being. All the articles I would recommend to read Asclepius in Balance, this knowing the drug, the ordinary sources of Materia Medica, and there are some more articles. If you see the list of the uh, lesser writings of Hahnemann, you will come to know all these articles are going to teach us that after searching and exploring every path, Hahnemann found out and said, there is only one way. Only one way. And the one way is this aphorism 19. This aphorism 19 is a discovery of not that very small kind of understanding. No, it is a landmark. These three aphorisms are landmark aphorisms in the history of the whole medicine. They are not that very small kind of understanding. How will you get this faith? How will you get this understanding? When you will go through the article like Asclepius in Balance by Hahnemann, where you will come to know that how shabbily human beings, sick human beings were treated. Very, very precarious conditions, especially the patients, those who are suffering with psychiatric diseases. They were chained and kept in the uh, boxes, and they were jailed and chained, and everything, every inhuman activity is being applied on them. In that way, Hahnemann is one of the uh, reformer. Is not only a medical reformer, he is a big social reformer. By finding out this very new way, I am telling you that this exact way of programming, exact methodology given by Hahnemann to know about the power of drug by testing on the human beings, healthy human beings. This very statement is only and only, not only statement, but the whole work, and not very small work, 100 medicines. He has not given the thought. He has not given only the methodology. He has not only given you 1, 2, 10 drug, he has given us 100 drugs. Well proved, very well proved on the healthy human beings. This is the most original work in the history of 2500 years of the medical history. Yes, it is being thought by many. As I learned from my professor, Dr. Elim Khan, my sir, Dr. Elim Khan, he told us, he taught us once that before Hahnemann, there were some 33 persons, those who thought of or tried to do such kind of experiment to know the power of the drug on human beings. But then here the Hahnemann's purpose was knowing the power of drug for the purpose of utilizing them, for the purpose of utilizing medicine as a remedy in given natural diseases. But all those earlier 33 human beings thought of this kind of work. Either their purpose was something else, or their methodology was something else, and little bit here and there. But then exactly using the drug as a remedy after knowing it exactly on the healthy human beings was only and only Hahnemann and nobody else. Even though when you will come to the practical part, when you will come to the drug proving, Hahnemann quoted one man, von Heller, whom he gave the credit that before me, this is the man, von Heller, Albert von Heller, who thought of this work. But then he thought, but did by Hahnemann, only Hahnemann, nobody else. So you might find aphorism 19 as a very small aphorism, or all the three aphorisms 9, 19, 20, and 21, All these three are just very small aphorisms. But please, I submit before every one of you, go through the articles I told you of Hahnemann, and then only you will be realizing the importance of aphorism 19. That it is not that very small kind of aphorism. It is a very very in-depth aphorism. That how after exploring each and every way Hahnemann reached to this point and say that if you want to know what exactly a medicine can do, you have to find out its power, what it is going to alter in a healthy human being, it is going to correct in already sick human being on the basis of similarity. It is not that easy. It just nobody came, no such angel came and whispered in the ears of Master Henry. All his all his tremendous, indefatigable labor he did throughout his life. It is nothing but his compassion to the suffering humanity. It is nothing but he always kept the faith in the Almighty. And he always said in the articles I quoted you that I am sure this Almighty can just be not that rude with the fellow creatures created by him, and he must have given some or the other way, and he is giving me this credit. Hellman says that the Almighty is giving the only just to shower a credit on me. He has shown me, he has enlightened me towards this path. You look at his humility. I'm sure you all will be going through these articles, and the way you are finding in my words, in my expressions, that how I'm so much convinced and having such faith in this work of Master Hellman. I'm sure if you read these articles, you will get similar kind of feelings. So, what is this aphorism? Let's just go once again. Now, as diseases are nothing more than alterations in the state of health of the healthy individual, we know this. That what is disease? Very simply, for a physician, homeopathic physician, it is nothing but the sign and symptoms, means alterations in the functions of a healthy one. And how do we know? They expressed in the form of morbid signs. And cure is possible. Cure is only possible by change to healthy conditions of what? Healthy conditions of the state of health of a diseased individual. From diseased individual to the healthy condition, cure is possible. How? It is evident that medicines could never cure diseases if they did not possess the power of altering man's state of health. So, any medicine, there is a one very important book of modern pharmacology, that is Pharmacology by Goodman and Gilman. It is like considered as a Bible of modern pharmacology. That book says regarding the medicines that there is no one medicine which does not produce side effects. I mean, that book is telling that every medicine has got a power. What power? Altering the health. And whatever this book is telling, Goodman and Gilman, they are saying that it has got a power causing side effects. Henman says, all right, we will just consider those side effects and we will be utilizing that very power only to make sick people healthy. This is the whole purpose of this aphorism, to know that it is nothing but then only one way a drug is known, that what exactly it is going to alter in the functions and the sensations. So this is something very important to learn. Now let us just have a look. What does this contents of table say about the aphorism 19? The alteration of the state of health in diseases, in the bracket the disease symptoms, cannot be cured by medicines otherwise than insofar as the latter has powers of also producing alterations in man's health. What exactly it is doing means the disease producing power of a medicine is nothing but disease curing power of that medicine. This is what is very simply we can understand. So this is all about in very nutshell regarding this aphorism 19, and just looking into if we have anything in this aphorism somewhere in the appendix. So appendix does not speak anything about this aphorism, and I'm looking forward if you all have some questions on this. You can just write me here in the live chat regarding this aphorism or regarding whatever so far we have discussed. If we see O'Reilly, what O'Reilly is saying about these aphorisms, since diseases are nothing other than alterations of the condition of the healthy people, which express themselves through disease signs, and since cure, cure is likewise only possible through an alteration of the patient's condition into healthy state, then it is easily seen that medicines would in no way be able to cure if they did not possess the power to differently tune the human condition that resides in the feelings and the functions. Indeed, it is evident that the curative power of medicines must rest solely upon this, their power to alter the human condition. The power of the medicine is their alteration power. Their altering the health is their power. So this is all something very, very important. I wish every one of you going to read those articles, because until and otherwise you read those articles, you will not get that feel which I just want to express or I am expressing to all of you. And if suppose I take up those articles here and start discussing, they are quite big and lengthy articles, pages and pages, and that will completely drift me away from the topic we are carrying with. However, I have given you some or the other gist of those articles before you, but then it's not sufficient. I wish every one of you going to read those articles, get exactly the feeling what I'm carrying within me, and I'm expressing with all of you, that those articles are very, very important even now to read, even now to understand. Once we are able to understand those points, it is going to give one very, very important benefit. Nowadays, I see the all those recent, very, very intelligent and inclined students of homeopathy, they are reading some third and fourth generation Mathematica. I urge all of you and all those intelligent and very, very inclined homeopathic students and doctors to please read these articles of Henman and have that feel of this aphorism 19, 20, and 21. This is going to benefit you that you will be going back to the original Mathematica like Mathematica Pura and such. And I'm sure once you're back to Mathematica Pura and such Mathematica, the first Mathematica, the pure Mathematica, your intelligence, your time, and your effort will be rightly fruiting, will be rightly awarding, because you read so much, you read lessons so much by some secondary, tertiary, or fourth generation Mathematica, which write the less exact symptom of the prover, but too much of imagination. I wish every one of you to be back to the original Mathematica. There, each drug, Henman has proved 100 drugs. Out of that, 99 are available in Mathematica Pura and chronic disease. And if you see Mathematica Pura, which is the proving on the healthy, there are 66 drugs given. And each drug, if it is a bigger one, maybe having some 1000, 1200, or 1500 symptoms. So you can say some 1500 lines, maybe somewhere in 500 lines, maybe somewhere in 400 lines. But if you're reading some secondary, tertiary Mathematica, you're reading pages and pages and knowing less and less. Here you're reading and knowing exactly. It is like buying a gold. You're buying a gold, but of 14 karat gold, which has got very less gold, but too much of other metal in it. Reading Mathematica Pura means buying exactly 24 karat gold. The whole metal is nothing but gold. So I wish that you will be going through all those articles as I suggested. And you will read these aphorisms, the concept of knowing the knowledge of medicine in a very, very understanding way. And you will be back to the original Mathematica. So with this note, I say thank you everyone, and I'm sure that you will be resolving yourself to do what I have suggested. With this, today I say all of you, thank you very much. Catch up tomorrow, and any questions, write me in the group or in the comment section of the video. Thank you very much everyone.